So my name is Rain Sherlock. I'm the head of evaluation at TASO. I'm going to give you some kind of very high level intros and important info today, and then hand over to my colleagues who are with me. So Sarah Connor is going to talk to you about one of the invitations to tender, and then my colleague Rob Summers will also talk to you about a second invitation to tender. Why don't we go ahead? So a quick overview of what we're going to cover today. As I mentioned, we'll go through some kind of key important info. We then will give 10 minutes or so to each of the invitations to tender that we're going to be discussing today. And you'll hear about those in a lot of detail, but it's one tender looking at randomized control trials and a second tender looking at quasi-experimental designs or quasi-experimental evaluations. And then we'll reserve a lot of time for Q&A. I think perhaps the most useful part of this session is going to be giving you an opportunity to ask questions that you may have as you think about responding to these invitations to tender, or potentially are kind of drafting your applications and proposals. So feel free to drop those questions in the Q&A function that should be somewhere on your Zoom screen, usually at the bottom, and we'll field and answer as many of those as we can towards the end of the session. So what do you need to know? I think the first thing to know is just TASO's commissioning process, which I think is familiar with many people now. And I have had a look at the kind of list of people that are planning to join this call, and there's definitely some familiar names and institutions. But what we do at TASO is we take a kind of dual approach to commissioning. So we've done this many times. What that means is that we put out open calls or invitations to tender to both higher education providers as a group that we would like to partner with and work with through a kind of research grants model, and simultaneously to independent or external evaluators who will work with TASO and those HEPs, higher education providers that we commission, to conduct the independent evaluation of the interventions or programs that we decide to focus on. This is familiar to us as a process at TASO, this kind of dual approach of commissioning the evaluator and the HEPs at the same time, the higher education providers. And there'll be many higher education providers on this call today, I'm sure, who are here to hear more about the specific methodologies that we're using, the types of interventions we're interested in, and we'll kind of give an outline of that information and answer your questions. But we do also have some independent evaluators from our panel of evaluators on the call today. And I think those evaluators will also be interested to hear the type of questions that higher education providers have, and even the type of interventions that higher education providers are thinking about including in their applications or proposals. So welcome to everybody, I guess, those of you who are responding to the higher education ITT and those of you who are independent evaluators. The second thing to note here is the methodological focus, and this is perhaps a little new or dissimilar to how we usually commission at TASO. So you will have noticed in the two invitations to tender that we're focusing on today are using kind of robust type 3 in the OFS standards for evidence methodology, so randomized control trials and quasi-experimental designs. And this is because we're kind of responding to a need or a request, an ask from the sector for more support, kind of hands-on practical support in conducting type 3 evaluation. And that's come from a recent stakeholder engagement exercise that we did to understand the barriers and potential solutions to conducting more and better type 3 evaluation across the sector. There were many good ideas that came from that consultation, and one of them was kind of increased commissioning and support with focusing on these type 3 methodologies. So in part, that's why we're choosing to focus on these two methodologies. Of course, it is worth noting that it's not the only way we will support the sector to conduct more and better type 3 evaluation. Our kind of business as usual support in the form of freely available online webinars and tools and guidance and resources will also continue. So this is just one way that we're responding and hoping to be able to support you as a sector to conduct type 3 evaluations. It's also then worth noticing the third point on this slide, the focus on student mental health and wellbeing interventions. So this commissioning round is focused on that, I guess, slightly broad category of student mental health and wellbeing. And we've deliberately left the information in the invitations to tender quite broad. And we're hoping that higher education providers will come to us with more specific intervention or program types that you're either planning to run or potentially have already been running in previous years. and that those interventions or programs have a kind of key outcome, primary outcome, secondary outcome that is focused on student mental health and wellbeing. So that's the kind of topic or subject area that we're particularly interested in for this commissioning round. A couple of other important things to note: deadlines. So there's two slightly different deadlines for the analytics RCT, randomized control trial project. We will be closing those applications at 1 p.m. on the 17th of May. For the quasi-experimental designs project, we'll close 1 week later, so 1 p.m. on the 24th of May. Once we've closed those deadlines, we go through a shortlisting process internally at TASO. So we score each of the invitations or the proposals in response to the invitations. And then both higher education providers and evaluators will be invited to a kind of follow-up call where we just clarify a couple of details for those who are our preferred suppliers based on the objective shortlisting process. Those follow-up calls are usually fairly informal. We try to share a list of questions or kind of clarification points that we have in advance, and then we set up a 30 to 45-minute call to go through those. It's also worth noting, and you'll hear more about this in a moment from Sarah and Rob, but the grant funding and the external evaluation support differs across the two invitations to tender, so slightly different budgets for each of the two projects. And similarly, the timeline differs. So for the analytics randomized control trials project, we need to wrap that up by March 2025. And again, you'll hear more about that in a moment, but just worth noting the different timelines. Where for the quasi-experimental design QED project, there is the potential for this to run beyond March 2025. And again, we'll kind of talk you through some of the nuance or intricacy there in a moment. Finally, then, it is worth noting a difference in the eligibility criteria for these two projects. So again, for the analytics randomized control trial project, this is open to any UK-based higher education provider. So you could be a provider in Northern Ireland, Scotland, or Wales, as well as England. Where for the quasi-experimental designs project, this is only open to England-based higher education providers, and that's in the approved fee cap category. This is just to do with TASO's internal funding streams, but just to make sure that you note that slight difference and nuance as well. So hopefully that's a kind of good overview of the kind of broad two projects that we're going to be talking about, but let's get into them in a little bit more detail. So I'm first going to hand over to my colleague Rob, who's going to talk you through the analytics for RCTs.
Good morning. So in this analytics wellbeing interventions RCT, we're wanting to use the power and scale of learning analytics platforms to deliver randomized controlled trials. So if we could have the next slide, please. We've previously demonstrated that they can be used to help deliver large-scale RCTs. So in our recent project, around 25,000 participants, of which 2,500 received some form of intervention, either a phone call or an email. But primarily, these analytic systems have been used to identify struggling students due to lack of engagement and help them re-engage with their studies, usually through some form of academic support. But increasingly, either the analytic systems themselves are being used to identify students with poor well-being, or the interventions that students are directed to are aimed at improving well-being. And this is what we want to investigate here. It's important that where the wellbeing interventions are light touch, we must make sure they are sufficient, and where they are more in-depth and costly, we should make sure they are effective. Okay, next slide, please. So the kind of interventions we're thinking about, and note this is not an exhaustive list of interventions, but just to give you the kind of idea. So maybe tutors and lecturers will receive communications from the analytics system, sharing data about at-risk students, recommendations for follow-up. It's possible that the tutors and lecturers, some of them have had training and some haven't, or some other difference in the way the interventions are delivered. Another one could be different ways of communicating with students, either through, say, email or phone call, or chatbot or text message or what have you. And we could also compare direct referral to support services or signposting. But in each case, the students requiring wellbeing support must have been identified through analytics, and the intervention's primary aim should be wellbeing, even if the long-term impact is to improve academic attainment or engagement, whatever. Okay, next slide, please. So just to reiterate what the requirements are, that the higher education providers, the HEPs, they must be based in the UK. They must have an existing analytics system. The interventions we're looking to test must be delivered in the autumn 2024 term. So we'd expect to collect the data in January, so it can be analysed in January and February with reporting in March. And the providers must be able to secure ethical approval for the impact evaluation and implementation and process evaluation. If there are any small providers, you may go in as a group with other providers, and this way you can sort of harness the power of multiple providers to get the sample size that you need. So impact evaluations tell us what works or what doesn't work, but they don't tell us why. And that's why we'll be also asking either providers or the evaluator to carry out an implementation and process evaluation. So implementation and process evaluations include desk-based reviews of documentation, interviews with those delivering and participating in the intervention, and may also include some quantitative analysis as well. So HEPs who believe they've got the capacity and skills are encouraged to develop and carry out their own IPE, which will be co-created with the evaluator. We think that will cost HEPs up to around £30,000 to buy staff time or buy the skills required through hiring a research assistant. HEPs who do not have the capacity or skills to develop and carry out an IPE can also apply, but leave the IPE to the evaluator. And we expect that cost for HEPs to be only around 10K. Next slide, please. So we'll fund up to 3 UK-based higher education providers or groups of higher education providers, up to 30K each, depending on whether or not you'll be doing the implementation and process evaluation. It'll be paired with an independent evaluator who will design the analyses that will be carried out, design the research questions in conjunction with the providers, and do the analysis and write the impact report. The output for the project include the implementation and process evaluation, and that will be, depending on what you've bid for, be done by the evaluator or the HEP, and the impact evaluation, which will be done by the evaluator. The project will start in June, with the final outputs delivered by March 2025. And I will now hand over to Sarah to talk about her quasi-experimental designs project.
Good morning, everyone. Thank you, Rob. So moving on to the second project that Rain introduced earlier, but just to stress, this is another really important method to provide that robust causal evidence, but it just means that students are assigned to interventions through sort of naturally occurring ways rather than being randomly assigned to different interventions. But it's still a really important, robust way to get that causal evidence of different interventions. And we just don't have this at the moment. So some of you on the call may be familiar with our Student Mental Health Evidence Hub that we published in the autumn of last year. And this shows that other than for psychological therapies, we don't really have that robust causal evidence on any sort of intervention. So currently we don't understand really what works to support student mental health, and it's really important that we do build up that understanding. But as Rain sort of alluded to earlier, we also want to provide really good examples of how this methodology can be used, so that the sector can see these sort of different methods, which can obviously be used to evaluate a range of different interventions, not necessarily just those that support student mental health and well-being. But primarily, we just really need to build up that evidence-based, which is why we're doing these projects. So on to the potential interventions. So as Rob highlighted in the previous project, this is by no means an exhaustive list. So we're really open to providers suggesting their own interventions. But within the invitation to tender document, and also here, we are suggesting some interventions that could work with the sort of methodology that we're suggesting as well. So one type of intervention could be those that are curriculum based. So for example, you might be running an additional wellbeing module as part of a course to try and support student mental health and wellbeing, and then we might compare wellbeing outcomes for students that do that additional module compared to those that don't. But also changes to delivery or assessment, so perhaps changing assessment types to reduce stress and anxiety and therefore support student wellbeing in that way. So we do need these interventions to have a clear mental health and wellbeing focus, but that's not to say they can't also support attainment, continuation, and retention as well. Also whole provider approaches, or perhaps an institution-wide change you've made to mental health and wellbeing support. So let's say, for example, you have decided to support all students in key transition points during their time with you, and you might have introduced wellbeing champions in every single course that you deliver. So here we might compare wellbeing outcomes before that intervention was introduced and after. And another option could be looking at referrals and signposting. So looking at the way that interventions are framed and communicated to students to see if that is impacting uptake of this support, because we do know that uptake of support does differ for different demographic groups, especially. So these are just some examples of different interventions. But as I said, we're really welcoming suggestions from providers in some of the interventions that they're delivering. But we do have more examples as well in the tender document. So in terms of potential methods that we could use, I by no means want to go into detail here on sort of different methods as such. We just want to understand, we're just showing a range of different methods that could be used, and mainly just so that you can be aware of sort of different data requirements for these methods. So we do again include a table in the tender document, which gives a little outline of how these methods could be used for different interventions, and some of the considerations and requirements for these methods. So for example, the difference in differences, synthetic control, and interrupted time series design, these require historical data, so sort of outcome data before the intervention was brought in. Whereas the regression discontinuity is less reliant on historical data. So it's just important to have a look at those differences. But I do want to stress that the evaluator will work with the provider to understand their intervention, to understand the data, and suggest what the actual design could be to evaluate. So we're not expecting higher education providers to be expert in these designs by any means. It's more just being aware of sort of data requirements, and this is how we'll assess applications that come through to see if they're suitable for these different methods. And on to scope and requirements. So we will be funding up to 3 English higher education providers, and they can apply for up to £10,000 each to support them with their responsibilities on the project. So this will involve working with the independent evaluator to basically, so the evaluator can understand their intervention, produce the theory of change for their intervention, understand that the data that they have. We're also expecting the providers to secure ethical approval from the ethics board or ethics committee as part of the project. And they'll also be collecting that outcome data directly from students and sharing that with the provider. So those are the sort of the responsibilities for the provider, but also they're receiving that sort of expert evaluation support from both TASO and the evaluator, and that sort of upskilling of teams in this evaluation methodology, and also can be involved in the outputs and any events as well that TASO will be put on regarding the project as well. But we are commissioning the evaluator to actually evaluate the interventions that are taking place. So conducting an impact evaluation using quasi-experimental methods to understand whether the intervention works, and also an implementation and process evaluation to understand how and why the intervention does or doesn't work. So more sort of in-depth qualitative methods in that sense. And the independent evaluator will also be responsible for the reporting and producing that impact evaluation and implementation and process evaluation report. And finally, just a note on timeline. So Rain did flag that we're a bit more flexible on this project. And I'm going to say upfront that apparently in my head, I thought it was still 2023 and not 2024. So sincere apologies there. It's April, it's nearly May, and I still think we're in 2023. But just want to stress, we are not going back in time to conduct this evaluation by any means. So I do mean to say 2024. So we'll be working with providers and the evaluator over the summer to understand their intervention better, build that theory of change, and get an evaluation plan and design in place. Then we're looking to evaluate interventions that start in the academic term. So these can be new interventions that you're trying to roll out next academic year, or they might be long-standing interventions that you just haven't evaluated in this way yet. So data collection would be starting in the academic term. And then this is where we can be a bit flexible. So depending on the intervention, we may just be evaluating something that lasts one semester or one term, and therefore do final reporting in the spring, in March. Or if it's suitable and feasible, we could also evaluate something that's taking place over one academic year, for example, in which case we do final reporting in the summer. But we do want to stress that we would have an interim report or a final report in March, and we also have a break clause in March as well. And this is just due to TASO's current core funding agreement. We have to implement a contractual break clause for the end of March. We really do anticipate being able to carry on beyond March, but TASO do reserve the right to terminate the contract in March, which is just based on our core funding agreement. But this will all be decided sort of in that scoping phase, dependent on the type of interventions that we're evaluating. So I'm just going to hand back over to Rain now for a little summary before questions. Thank you.
Thank you, both Sarah and Rob. So yeah, I guess a quick recap. So the two projects that we're discussing today are the analytics randomized control trials and the quasi-experimental designs. So for both of those two projects, TASO will commission up to 3 higher education providers or 3 key partners. The asterisk here, and as Rob outlined, is that it may be that there are a group of higher education providers who want to put in one joint application. That's absolutely fine. As Rob alluded to, often if you are smaller providers or providers working with cohorts of students that are bound by sample size, it's possible to achieve the power that we need to use these methodologies by combining numbers across institutions. So a multi-site evaluation. Happy to answer questions on that in the next kind of Q&A section, but we'll commission up to 3 key test sites per project. The grant funding, as you've seen and heard, does differ across the 2 projects. So for the analytics randomized control trials, TASO will be providing between £10,000 and £30,000 to higher education providers to partner with us and take part in the evaluations. And for the quasi-experimental designs project, that is up to £10,000. Of course, both projects and all higher education providers that TASO commissions to work with will receive an independent evaluation. So we will also commission independent evaluators to work with the higher education providers to conduct both the impact evaluation and the implementation and process evaluation. Just a reminder on that eligibility criteria. So for the randomized control trials project, any UK provider can apply, but for the quasi-experimental designs project, providers must be in England and they must be in the approved fee cap category. And then of course the deadlines, I think this is familiar now, but the RCTs randomized control trials project closes on the 17th of May at 1 p.m, with the quasi-experimental designs project closing 1 week later, so on the 24th of May. So a couple of weeks away for both. We're going to move on to questions, and I can see that the Q&A chat function is beginning to look busy and full, which is great. So we'll have lots of opportunity to answer your questions. A couple of things to note. One is that we are going to also provide a written FAQs, frequently asked questions document, as a result of this webinar. So all of the questions that you're submitting into the Q&A chat function will kind of mop up and respond to in writing, and we'll publish that on our website and also send it to you as part of the post-webinar follow-up comms. So if you want to share that with colleagues who weren't able to join the call today, that will be available by the end of the week, and we'll make sure that that lands in your inboxes. Whilst we have a look at the questions that are coming in, I'd also like to poll you all, if that's okay. And as if like magic, my colleague Alicia is going to pop a poll up on screen. So we're just interested to understand which of the invitations to tender ITTs you're interested in or would like to apply to. So if you could just indicate by ticking the boxes whether you're interested in one or both, that will really help us understand the kind of level of appetite and what we might be able to expect in terms of applications coming in towards the end of May. I will give you all a moment to respond to that, and I'm going to unshare my slides so that you can see us all for the Q&A. So we have many questions, and I'll do my best to group questions that are similar and make sure that we get to everything. So let's perhaps start, Rob, with a couple of questions that are specifically relating to the randomized control trial project, if that's okay. So the first question is asking, is there any expected or kind of approximate sample size for the RCTs project?
We would probably expect at least a couple of hundred per intervention or arm of the trial, at the very least. Preferably quite a bit more, but I think a couple of hundred is the absolute baseline, because there's likely to be attrition and so on, which would reduce the effective sample size somewhat more. So I think that's a baseline.
And just to check, when you say a couple of hundred per arm, that's for the treatment group and the control group. So we'd be looking at kind of 400-500 as a whole sample.
That's right. Yeah, and if you're trialing many intervention or comparing many interventions, as however many arms there are, by a couple of hundred. Super.
Thank you very much. We have another question, Rob, for the randomized control trial project from an anonymous attendee. So this question is asking, the randomized control trial RCT project seems to refer to mental well-being, whereas the quasi-experimental design project QED refers to mental health. Is this a deliberate distinction? I appreciate that this will be down to the HEPs and applying specific interventions.
Yes, this is a deliberate distinction. We are not in the business of running clinical trials, which if we were running an intervention that directly measured was a mental health intervention, that would be a clinical trial. We're not equipped to deal with that, and we don't believe HEPs are generally either. So yeah, it is purely for where well-being would be the primary outcome.
Yeah, so it's a slight kind of nuance of terminology, I think, that's worth noting there. So really what we're trying to measure at TASO when thinking about student mental health and well-being across the sector is what we think of as non-clinical outcomes. So they're kind of metrics or measurements of student well-being and mental health, things like kind of financial well-being, sleep quality. I don't know if the team can help me out with other robust mental health and well-being outcomes, but not what you would see in a kind of clinical or health research field. And of course, when we talk about or we conduct randomized control trials, it's important to be quite clear that we're not proposing that we're running what's called a clinical trial, as Rob has alluded to, which would be something that sits more within a healthcare profession. So it is an important nuance in terminology. Sarah, did you want to come in on anything there? Look like.
Yeah, just wanted to come in quickly. On our student mental health hub on our website, we do have a sort of whole resource which is around collecting mental health and wellbeing outcomes, as Rain says, sort of in a non-clinical setting. So they do measure time symptoms of things like anxiety and depression, but just in a more, so for example, one of the questions is, or statements is, I have felt tense, anxious, or nervous in the last 2 weeks, or something like that. So you might still measure some symptoms of anxiety, but it's less sort of diagnosed or clinical conditions. And yeah, that's a good point, that we sort of used mental health and well-being together when describing that quasi-experimental methods project. So yeah, we are anticipating they're going to support different mental health and well-being outcomes, but as Rain says, more in a non-clinical setting. And we do refer to something called the GP core in the actual invitation to tender document, which you can have a look at, which is just an example of a mental health and well-being survey that you can ask students in this sort of setting.
Super, thank you, Sarah. Rob, I'm sorry, I'm always coming to you, but I'd like to cover off some of the other RCTs questions, if that's okay. So we have another question coming in from an anonymous attendee asking if the examples given in the ITT, so for instance, comms to lecturers or referrals of at-risk students, can you apply to evaluate multiple different types of interventions or sub-interventions, or do you have to select just one for the trial?
What I would advise you doing is in your application is listing the various interventions that you've got, and in combination with the evaluator, we will scope out the best one or ones that are best suited to being evaluated, either due to sample size or the feasibility of running a randomized control trial. So if you do have a basket of interventions, then that would be what I would suggest doing.
Super.
There's one question that came in the chat that I just would like to quickly answer.
Sure.
It's, can you define analytic system? And I think that's quite an important one. So my very quick coupled together definition is that an analytic system is any system that uses data about how students interact with the provider to identify students that need support. So usually this is sort of attendance data or data of students interacting with a virtual learning environment or library books or swiping into the institution, but anything similar would count as an analytic system.
Thank you, Rob. And for anyone who might be dialing in from a higher education provider and isn't sure whether their provider uses an analytics system, could you give us a couple of examples of the kind of commonly used programs so that they might be able to ask colleagues internally?
Yeah, so JISC have their system, Data Explorer, I think the name is, Solution Path are another common provider. Many institutions roll their own as well. Also Civitas, I believe, is another large-scale provider as well. But yeah, any system where student engagement is provided, data is something that's provided or accessible will count.
Super, thank you. One final thing just to add to that, as Rob said during his presentation, we did recently conduct a randomized control trial of learning analytics systems. I think if you just go to Google and Google TASO learning analytics randomized control trial, the right thing should come up, which will give you a nice idea. It's not the same and it's not directly comparable, but a kind of nice idea of what the systems are and how we intend to evaluate them using this project as well. Okay, I'm going to move us on to some questions that are more specifically focused on the quasi-experimental designs project. So Sarah, I'm looking at you if that's okay. One question is asking, in the application, in the ITT, the application form is saying that the outcome data will be collected by HEPs rather than evaluators. Can we just clarify, and it's, I guess, relevant to both impact evaluation, but also implementation and process evaluation, who will be responsible for the data collection between the evaluator and the HEP?
Yeah, so this is a little nuanced, a little complex. complex, I suppose. But essentially, the evaluator will be commissioned and responsible for the design. So they'll be suggesting what outcome data should be collected. So what wellbeing outcomes should be collected, i.e. via a survey, but also what attainment data, what attendance data, or any other relevant data should be collected. So TASO and the evaluator are sort of responsible for that in conjunction with the provider, but obviously naturally where the provider is in terms of collecting data, they'll be in that position to collect that sort of attendance data, attainment data, and potentially survey data. So their responsibility is more to share that with the evaluator, and the evaluator will analyze that. So the provider would be responsible for sharing anonymized student outcome data, essentially, for the evaluator. Rain also mentioned the implementation and process evaluation, and this is a little different because, again, the evaluator will be responsible for this, but they will also do the data collecting. So essentially, potentially interviews with students or focus groups with students, interviews with staff, and collecting that data needed for the implementation and process evaluation. So they'll be sort of responsible for the design and data collection for that part of the evaluation. But in terms of collecting that anonymized data for the impact evaluation, so on wellbeing, attendance, attainment, things like that, that has to be the sort of provider's responsibility because they have the access to that, and then they'll share that with the provider. Hopefully that makes sense.
Thank you, Sarah. And yeah, it makes sense to me, but if there's any clarification questions, do feel free to drop follow-ups in the chat. We've got lots of time. Another question that is pitched at you, Sarah, I think for the QEDs, quasi-experimental designs, need to get good at the acronyms, project, but actually it's relevant for both, is that we mention in the invitation to tender documentation, and also as we spoke just now, that one independent evaluator will be commissioned to work with the higher education providers. And this person is asking, is there a possibility that several evaluators will be appointed, each to work with one higher education provider or groups of providers if they apply? So yeah, the question was asked specifically for quasi-experimental designs, but it is relevant for both, and feel free to jump in, colleagues on the call, but I think the short answer to that is that no. What we're going to do is commission one evaluator from our panel of evaluators, which is a kind of group of evaluators that we draw from and work with quite frequently. And that one evaluator will be responsible for evaluating each of the different evaluations within each of the different higher education providers or groups of higher education providers if we commission a kind of group. And there's lots of reasons for that. I probably don't need to go into all the details, but it's quite useful and very important to have an evaluator that has that bird's eye view and can see kind of similarities and differences across the sites, particularly if we are working with groups of HEPs in a multi-site trial. We need to make sure that the interventions that we're evaluating and the ways in which they're being implemented is kind of consistent and comparable. The other thing to note here is that we have commissioned in this way quite a few times now. I don't know if I know the exact number, but definitely upwards of kind of 10. And this is always the process we follow, and it does seem to work so far, at least. There are lots more questions coming in, and I'm losing my nicely formatted approach of firstly RCTs and now QED. So bear with me while it may become a little less orderly. But I also haven't introduced our colleague Christoph, who is on the call. Hi, Christoph. Christoph is our Chief Research Officer at TASO. And I wondered if I could direct a question to you, Christoph, and again, colleagues, feel free to pitch in. But this is on the implementation and process evaluation. And the question is there a reason that we are, for the randomized control trials project, giving higher education providers the option of being more involved in that implementation and process evaluation, while for the quasi-experimental designs, we're proposing that the evaluator plays a key role in the implementation and process evaluation?
Thanks, Rain, and hello, everyone. There's no specific reason other than considerations that have to do with the different funding streams that we've been able to mobilize and access to commission the RCT projects and the QED projects. I mean, some of the considerations that went into the way we designed and published the ITTs is, we want a really good quality evaluation at the end of these projects, you know, to inform policy and practice, and to establish what works, and help higher education providers design and implement effective interventions in this space. So quality is a key consideration, but adjacent to that is also an intention to support higher education providers with learning new skills, building capacity, and capability to do more evaluations in this space. So that's sort of another consideration in our general approach, consistent with TESO's mission. So particularly the RCT project that's funded by the Evaluation Accelerator Fund from the Cabinet Office has this ethos in mind to do really good evaluations, but also help with upskilling and promoting and capacity building in the sector.
Which is a nice segue into another question we had on when TESO's IPE implementation and process evaluation guidance will be published. So I can answer that very quickly, which is just to say that the guidance will be published later this week, and will be accessible on the TESO website. We will also be conducting a 1.5-hour webinar on how to use the IPE implementation and process evaluation guidance. That webinar is yet to be scheduled and likely to fall into the beginning of June. So keep an eye out in the kind of TESO newsletter for that webinar when it comes. And the segue, as Christoph nicely teed me up, is that we, regardless of working with higher education providers through this commissioning process and evaluators and appointing evaluators to work with providers, we do, of course, also continue to encourage the sector to upskill on each of these methodologies, be that implementation and process evaluation, randomized control trials, quasi-experimental designs. So we'll continue to publish guidance and resources and conduct those kind of online webinar format training courses so that everybody has access to the guidance. Okay, I'm going to move us on to another question, which is a nice question for you, Robert, asking about whether or not for the randomized control trials project, we will be looking for diversity in terms of the systems or analytical programs when shortlisting and appointing grantees, or HEPs, I should say.
No, I don't believe so. The feasibility will be purely about the intervention, sample size, and whether or not it and how feasible it is to randomise your population. So if they all happen to be JISC-based systems or solution path-based systems or what have you, we don't mind.
Yeah, totally agree. Another question from Jack at King's College London is saying, is it likely that the interventions for the randomized control trials project will be completely novel, or more likely that they will have been implemented in previous years' terms? It's a good question, and it's probably a question for higher education providers. What do you think, Rob?
Indeed, I think it's easier to get ethical approval for a novel intervention that you haven't tried in previous years, because you can start a rollout phase where you are purely testing a new intervention, and I think it's easy to justify to an ethics board. But it also shouldn't be impossible to justify to an ethics board as well if you don't have the evidence that an intervention you've been using works, that you can use a previous one. Our learner analytics project was doing just that, in that one of the providers had already been offering a phone calling service to struggling students, and students who'd been identified as non-engaging with their institution were either given a phone call or an email intervention, and that was decided through a random allocation. And the way to satisfy the ethics board that students on the email-only intervention would get sufficient support was that if they triggered another no engagement alert, they also received a phone call automatically. So that's one way round obtaining ethics approval for interventions that you've previously been running. So it's a sort of a delayed RCT, essentially.
Thank you so much, Rob. You started answering a question from James, which I was going to come to each of you for thoughts, and I also have some thoughts, but just so that everyone can hear the question, James is asking, so as a trial coordinator, he fully understands the need for running randomized control trials, whether they've tried to embed randomized control trials with analytics specifically, and have received some pushback from their ethics board and kind of data governance leads at the higher education provider. And the kind of pushback is based on the rationale that people are hesitant to not provide an intervention or an activity to students who might benefit from it. So a kind of whole institution or whole university approach, where we randomize people into treatment and control. Rob, you have very much touched on some of those points, and your reflections are very similar to what mine have been. I wonder if you've got any further reflections from the learning analytics trial that we ran last year, thinking about kind of useful ways to help ethics boards understand the trial and what we're trying to achieve.
Yeah, so in our learner analytics trial that we reported on this year, that we ran a couple of terms ago, we compared a phone calling intervention with an email only intervention for students who'd not been engaging with their studies as identified by a learner analytics system. Now, the default assumption was that the calling service would be effective at getting students to re-engage with their studies. And we found that there was no difference in impact between the two. So when universities are concerned about students not receiving something that may benefit them, well, we've showed that maybe it didn't benefit them. And if you don't have the evidence that something is beneficial, you ought to be testing it. And maybe you can test different ways of delivering that intervention if you're really concerned about withholding information, or, as I said before, delaying that intervention for half the students or so on. But my very strong belief is if you don't have the evidence that something works, then you should be testing it, and preferably with causal evidence. If you do have good evidence that something works, why are you doing an RCT in the first place?
I don't have a huge amount to add to that, Rob. I think one other small tidbit that I would say is that when working with research ethics committees over the years, one thing I have found quite useful is to use the ethical principle of equipoise. Don't know if that is familiar to people, but this idea that we don't, as Rob has described, the ethical principle of equipoise just explains that we don't really know whether or not something has any impact, be that positive or negative. So we're currently sitting at this like balanced position of just not knowing. And if you just Google TASO research ethics guidance, there's a kind of chapter on equipoise that explains the principle and how to use that to rationalize why we're proposing certain methodologies for certain interventions or programs. And it's a really useful thing that I often fall back on when we're drafting and writing research ethics proposals. Just before I move on to the next question, Sarah or Christoph, was there anything you wanted to add to that kind of broad set of reflections on the ethics question?
Two quick things. Let's also make sure that we include a link to these ethics resources provided by TASO in our FAQ document for everyone to benefit from it. But also, of course, we recognize that there are lots of ethical discussions around the use and implementation of RCTs. For sure, we want to be helpful, but there's lots of ways of making experimental research or quasi-experimental research more palatable by using waiting list designs, for example, or the idea, Sarah, we've just been discussing yesterday, to compare different subpopulation of students, not necessarily withholding treatment, but finding different ways around that. I don't know if you want to maybe give some examples on that, Sarah.
Yeah, there is different options. So, for example, a randomized encouragement design. So potentially you're just randomizing who receives information about an intervention, or the way they receive information about an intervention, and then you're looking at uptake of an intervention, which is still a really important outcome in itself, because if students aren't attending these interventions, then they're not going to work. So that's a really important outcome as well. So there is different methodologies that you can use, and definitely, yeah, that's sort of a rollout of something. So trialing it in one part of the institution, and seeing relatively quickly whether that works. So perhaps after one term, one semester, and if it does, then of course do roll out beyond that department. But as Rob says, if we don't know if something works, then it's really important that we do trial that robustly to understand.
Super, thank you all. We have about 9 minutes left and a couple more questions, which I'll get to in a moment. But just a reminder, if anyone does have a burning question that you haven't yet asked, now is the time to drop it in the chat function, or the Q&A function, I should say. Just before we move on from ethics, there's a quick question asking what's the likely time frame of a HEP for the ethics process or gaining ethical approval. It's really hard to answer that accurately. It's very specific on the research ethics committee at the specific higher education provider. It depends on the ethics board cycle, how frequently they're meeting, when their next meeting, depending on when you make your application. It also will depend on the scoping phase of the project in terms of the exact design of the randomized control trial or the quasi-experimental evaluation, because that will influence which kind of risk category the ethics proposal goes into. So I'm sorry that we can't provide a very specific or kind of clear answer on that. But Rob, I wondered if you would mind just quickly sharing, if you remember, how long the ethics process took for our previous learning analytics trial.
So in my experience, ethics processes can take from a couple of weeks to 3 or 4 months. It can, and perhaps longer in some cases. As Rain says, you just need to go to your ethics provider or your ethics board and deal with them and sort of talk them through it. Usually, again, in my experience, that they welcome an approach prior to an ethics submission. So if you're thinking of applying to these ITTs, go talk to your ethics board right here, right now.
Good tip. Okay, a slightly different question. So we have a question asking, will TASO broker the relationship between higher education providers and the evaluator and commit to publishing the results, thinking specifically of situation where null or negative results might be found? The short answer to that question is yes, in every account. So yes, we will help support and kind of broker the relationship between higher education providers and the evaluator. The exact kind of nature of that will be decided once everybody is commissioned and in place, but we do have a kind of bi-weekly meeting check-ins, and we'll make sure that everybody has an introduction and an introductory workshop, and we'll do some relationship building. But slightly separate to that, I think the question about publishing results is really important. And again, the answer there is yes, TASO does publish the results of all evaluations that we commission. Rob alluded to this earlier, but we do have a real mixture in terms of the findings on studies or evaluations that we've conducted in the past, a combination of null results, which just means that we don't really have confidence in whether or not the intervention works or doesn't work. So no, we're not confident in the impact or effect of the interventional program. We always publish those results. And similarly, if we find what we would think of as a positive effect, so the intervention or the program has some positive impact on students or beneficiaries, we would publish those results. And similarly, if we found, potentially even more importantly, if we found that an interventional program was having a negative effect and we were confident in the evaluation methodology and confident that that was a true negative effect, it is important to publish those results and share those findings. Of course, we're not blind to the sensitivities of each of those, be kind of positive, negative, or null results. And we will support both the evaluator and the higher education provider in the writing up of whatever we find, but we'll absolutely publish. I don't know if anyone wants to add anything to that. Then we have a question which I have to say I'm not sure what the answer is, so I'm going to have to take this one away and respond to it in writing. I believe we can get the exact contact details of the person asking. I do have the name here. The question is, can we make a submission with a students' union? And as I said, I don't know the answer to that, so I'm going to come back to you with a specific response, and we'll do that as soon as we can after this webinar. So thank you for your patience in asking that question. Sorry we couldn't answer it. We've got 5 minutes. I'm going to take one more question. given that there is the potential to be testing interventions provided by external companies that might be willing to provide some match funding, as in their benefit to get a robust evaluation, is there a second part to that question coming potentially from the anonymous attendee? I'm sorry, I can't see who submitted it. Can't tell if it's an evaluator or higher education provider. If you're still there, and you don't mind clarifying the question, we do have a little bit of time to answer it. But if not, I think we can give them a couple of moments. I think we can begin to kind of wrap up and close the webinar. So as I mentioned, we will be writing written responses to all of the questions that you've asked today. We'll publish those on the invitation to tender webpage on the TASO website, so do keep an eye out, but we'll also make sure that it gets sent to you in your inboxes as part of the follow-up communications from today. If you had a question and didn't have a chance to answer it, or if you think of something afterwards, please do email us. The information for how to do that is included in the invitations to tender. You can email research@taso.org.uk, I believe, and we'll respond to you in writing there as well. We do have with 3 minutes to go, the question has come back in. So this person's asking, is it possible to allow match funding to strengthen the application? So I think they're asking, can we partner with external companies that may be willing to provide funding to benefit the robust evaluation and apply with match funding? If I've understood the question correctly, the answer is no. As an evaluator working on a TASO funded evaluation, you need to be a part of our panel of evaluators. So our panel of evaluators is a group of organisations that we work with to conduct evaluations who are all commissioned through an open call process. You can see who is on the panel on the TASO website. And if you are an evaluator on that panel, you can collaborate with other evaluators on the panel, but not with people who sit outside that panel. I think that's my interpretation. But again, if the question, that wasn't the question, or if I've misunderstood, please do email us and let us know, and we'll be able to answer it. You look like you might be able to say something, Sarah.
I was just my interpretation of the question was more, I'm imagining, let's say if it's solution path and an analytics system, could they match the funding because they want it to be evaluated robustly as well? So they're not conducting the evaluation, they're just putting in a joint bit with a HEP. That, I don't know, Rob, if that was your interpretation.
I'm wondering if it means that they would provide some funding to the HEP in order to help them carry out, say, the IPE or more in-depth evaluation, or just provide more resources.
Could I ask the person asking this question to email us at research@taso.org.uk, and we will respond properly, because it's an interesting question depending on what exactly the nuance is. And we'll also add that to the FAQs document that we publish so that everybody can see the response to the question. I think I'm going to leave us there because we're getting to time, but just to say thank you so much to everybody for attending. Really useful to hear your questions from higher education providers and a couple from evaluators in there. So yeah, thank you for joining us. Keep an eye out for that FAQs document, and a big thank you to colleagues Rob, Sarah and Christoph as well. Have a lovely afternoon, everybody.